Welcome back to the next Healthy Chicago episode. My name is Calderon. I'm the Director of Behavioral Health Program Operations with CDPH. I use she, her pronouns, and I'm so excited today to introduce you to Jackie Hoffman, the founder of Peace Runners, to talk about some really great work he's doing in community and how it connects to CDPH's strategic plan. So Jackie, introduce yourself.
Hey y'all, I am Jackie Hoffman, the Executive Director and founder of Peace Runner 773.
Amazing. So, Jackie and I crossed paths talking about healing and justice through sport at a different event. And so we thought it'd be a great idea to bring this to an episode to all of you to learn about his work in using exercise and sport to help build community and healing. And so, Jackie, tell us a little bit about how you built Peace Runners.
I built Peace Runners and I started all of this as being a son and being a community member. I remember coming home, my grandma had passed, and was living in Atlanta at that moment. But I came home, and I was looking at my parents, and I'm watching my parents age. And I heard about the life expectancy gap through that. But then I was sitting on the couch, and me and her were just chatting. And her doctor she had a doctor phone call. This was during COVID. So during COVID, it was this point where, like, when you usually go to the doctor, you close the door. And anything that happens in the doctor's office, nobody knows. Mom comes out and say, "I'm doing good, son. He said I need to just walk a little bit." But at this point, like, her doctor was really telling her, like, the high blood pressure, the pre-diabetic, all of these chronic illnesses, and then, like, directly correlating that with the life expectancy gap with the area code, with the 60624. And he's talking about this and saying, like, hey, like, most of the people are dying at this age. This is life expectancy. It was like 67 at that point. My mom was 62. I immediately turned to what can we do? Like, what's the strategy to try to, like, help you right now? Because I heard it and I looked at my mom as, like, superwoman. Like, everybody looks at their parents as, like, superhuman and we don't know their weaknesses. But at that moment, I learned about my mom's weakness. I challenged her for a mile a day. And she was on Facebook Live and she was like, Facebook Live, I'm going for my mile a day. And she started to walk the community. But as she walked the community, I was an avid runner already. So I was running. So I'm running the community. She's walking. She gathered a whole bunch of elder ladies. I call it younger hearts now. And they were walking. And, like, they stayed consistent. They kept showing up. As I kept running, they kept walking. My mom has now lost over 68 pounds. Her medications went from 13 to 0. And her doctor visits got extended from every 2 months to every 6 months. That's my why. That was my purpose for starting Peace Runners, is saying, like, how many more people don't know about this life expectancy gap? How many more people don't know about the things that they could do in their control to be able to reverse those things, to kind of, like, fight back from this life expectancy gap that we're having in Chicago.
Wow. So here you are in a pandemic with the opportunity to hear your mom's doctor's appointment and heard some pretty concerning things. Yeah. And you were able to turn that around into action. And not only did you support your mom in her healing and sort of health process, but you also brought on other people, the young and hearts and the rest of the community along with it. So you mentioned the racial life expectancy gap in Chicago. And so this is CDPH's primary goal in our strategic plan for 2025 is to address the 11.4-year gap between Black Chicagoans and white Chicagoans and the life expectancy. And we are incredibly concerned by that disparity. And we have action plans around 7 key indicators. And so chronic disease is one of the top indicators for why we see that racial life expectancy gap. And so, you mentioned walking around the community. So where were you all walking? What neighborhood were you at? And tell me more about community.
Garfield Park. Garfield Park is my heart. That's my home. For everybody else, when you look at the news titles and you see everything that's happening around it, some people look at it as, like, they deemed it as, like, not a runnable or walkable community, because you can look at the run and walk scores of a community. And for me, it was like to change that narrative, to show up for the community and, like, run. But it's also, like, beautiful to see the community healing from us running and walking in that space. So to see the younger hearts walking, and then to see 100 other people every Saturday go run this community that people, like, naturally probably wouldn't even run. And I always say, like, you got so many other communities where you go to and you see Oak Park and you ride through Oak Park and so many people are out running and walking. And like, I was like, let's do that in Garfield Park. Let's bring that to Austin. Let's do that in Lawndale. And what our program has now done is, like, we had over 1,100 people run a 5K, 187 people run a half marathon last year, and we had 43 people run a Chicago marathon. People are running and walking and taking space in their own communities. So if it was point number one was like, yes, let's get this health going. But then also, like, let's make sure that we are healing and, like, showing people something that they never seen before, but then also something that can, like, provide that access point for everybody in the community to say, like, I want to start walking. I want to take care of my health. I want to start taking those steps, and they can see us at the Golden Dome steps every Saturday.
Wow, that's awesome. What has it been like for you as a founder to start an organization, and how have you built it over time?
It's a community need, and that's what we did when we created programming. We created a programming that said, okay, running and walking is one point, and then let's add nutrition. So then we added nutrition with Good Food is Good Medicine, an amazing partner that shows us how to cook the food, but then also, like, breaks down the nutritional value of the food. And then we started to say, like, okay, if managing stress was a problem, let's bring in mental health. My wife, Jackie Hoffman, has started Mental Health in Motion. Mental health and motion has been huge for the community because it provides an access point for people of the community to say, I never thought about therapy. I never thought about actually going into this thing. Like, and this is in my community. They're bringing it to my front door, and they're not making a barrier for me to access it. So we do it free, and I actually was a part of some of the groups, and just to see some of the people and see how they actually need it. Like, they don't even know how to start to even go to therapy, or people think therapy has a negative thing to it. Like, I don't want to go there. I don't want to be there. But when we bring it to the community and we built that trust with our community, now that trust and access point becomes the point where, like, somebody says, I need help. And everything that we do has truly been whatever the community wants and needs at that point, to be able to make sure that this person, a person, is a better person holistically and the best version of themselves.
Mm-hmm. Yeah, it sounds so community driven and passionate, and that you're attuned with not only your family but also the people who are running with you and coming to you with the different challenges that we face. It's truly amazing. And, you know, we know that there's power in connection and through sport. So I'm curious to hear about some of the relationships that have been built or the connections that have been made between people, or maybe some success stories that you've seen from people participating.
I truly believe in that the movement that we have now is truly special because it's intergenerational. My mom's story is one story. Miss Maddie is 63 years old. She has run 3 half marathons. We have Miss Sonia that is running her first half marathon, and she's a young at heart. That's powerful. It's powerful because it's the belief in us, but then it's also people removing the limitations that they have on themselves to say that I don't run, I can't do that. And just because we believe in them and we show up for them consistently, they start to believe in themselves at another level. We also got Kobe. She was the first of our Breakthrough. We have a partnership with Breakthrough. We do a youth run club. She's 14 years old. She ran a half marathon last year, and then she came back and ran it this year. But when she came back this year, she brought 6 more youth participants, and now we actually have a 16-year-old. This is the minimum age you can get into Chicago Marathon. Zachariah, he's going to run the Chicago Marathon. Wow. So just to see the movement from all ages of people started to prioritize their health and wellness early, we want to be that resource, and we want to also let them know about the life expectancy gap and bring awareness to it early on so they can have the tools and be prepared for everything that life can kind of throw at them, because they'll be built for it through the programming that we provide, to say, hey, when life get tough, we don't need to go this route. We could probably go for a run. We could probably do yoga. We can probably learn how to cook, and that might be a habit. But, like, the more tools that we have in our toolbox throughout life is the things that we lean on when everything else starts to crumble or stuff starts to happen in life. So.
Mm-hmm. Yeah, to be intergenerational in that way really teaches all ages, right? From different people and walks of life. And tell me about some other ways you've engaged youth or have incorporated youth programming.
So we did a power hour for our older youth at Al Raby, which was pretty cool because we didn't even do a lot of run. We just talked about the tools, run, walk. We brought in a strength coach, Coach Ju. We did strength training with them. We did yoga. We did meditation. And we were like, is this everybody's first time doing yoga or meditation? My first time doing yoga was 30 years old. And I feel like it's been the biggest tool for me because it allows me to put my phone away and allows me to get time for myself. So now for those young kids at the school at Al Raby to already have resources to say, I know what meditation feels like. I know what yoga feels like to put my phone up and actually do these movements. It was really huge for them to get their feedback. They were like, I love this. We're going to try this at home. It's something that we could do at home. Tools that they can use later on, or even when we're not there, they can go do that at home to relieve stress or kind of get those jitters away from being a youth in the inner city of Chicago.
Mm-hmm. So really planting those seeds and those practical tools. And mindfulness is and yoga are great mechanisms for that.
Yes.
So, running, it all starts with the running, is the doorway to all these other things that you can help support people in and that people can support each other in. So I think it resonates with people running, whether they like to run and they do it frequently or those who are like, not so much into running. You mentioned your mom walked for a while, right?
Yes.
Or so what are some tips that you would give to people who might be on the fence about starting to run or maybe engaging with peace runners?
Just start. That's the biggest tool. It's not perfect. And the beautiful thing about running is that 150 people can do it at the same time. But 150 people have different experiences or their journey when they're running. It's a beautiful sport. It has helped change my life. It's took me some amazing places. This year alone, I have run Tokyo, Japan Marathon. I have did Boston Marathon, and in 5 weeks, I'm running Sydney, Australia with a team of 11 fundraising. Yeah, we're fundraising for Peace Runners programming and initiatives. And then we have a team of 5 going to Berlin, and we have a team of 10 going to New York. And all of these places, they're fundraising for Peace Runners. So another thing that we do in Peace Runners is that we know that it's a lot of amazing grassroots organizations that are doing work in the community but don't have funding. So we make sure we're that point to that if a youth football team needs some support, we show up and we go run a lot of miles to make sure that we're fundraising so that we can give back and put some more funds into our community and our youth sports teams around that's also doing amazing work. So,
wow. So you're mentioning fundraising is a big piece to driving the organization. What are some other ways that you can support it financially?
Showing up, I think that when we say like we're the community, whatever the community needs, we kind of show up in that way. Like the mental health, we got 3 mental health clinicians. I had to find a grant writer because we're a nonprofit and we're like, we need to go get grants. And even though everything is getting shortened and cut up, and like that's a hard point. But to find a grant writer, to find people that know resources, space was a big thing. Like if we wanted to do yoga and it's wintertime, Chicago has winter season, we're still active because we know that prioritizing health is not a thing where we can say just 15 weeks is enough. We need to be a 365 thing where like people still have access to a space where they can go do a HIIT training, a strength training. So staying connected with those things, but just it's so many resources that people can bring that can help us out. Those small things lead to big changes. So it's the same way with health. The small things that you do with your health can lead to big changes. So anybody that's aligned, that like willing to help or see a need or see a point where they can help peace runners, we welcome them to come out and help us.
That's great. No,
yes.
And that's great to get the grants and the things to support the work that you're doing. And, I think the life expectancy gap is hard to digest, and there's, we feel a lot of urgency at the health department to address it. And so, what are some ways that you raise awareness about it in community?
Showing up. I think that's the biggest thing. It's simple. Showing up and meeting people where they at, meeting them with love. And I think love is the biggest thing. Like, I don't make a barrier. I don't make people earn that. Mm-hmm. And when we're talking about healing communities, we got to show a lot of love. We got to overextend that. And I don't think sometimes it's not even a strategy to that part. It's just showing up and saying like, hey, I'm here to support you. In any way that we can. And that's why Peace Runners has been so successful, because it's like a family. Mm-hmm. All of my family is included in this. And then the extended family is a community, and everybody picking up in any way that they can to help out. But then like seeing the person that watches us for 2 weeks to say, hey, if you want to come out here and walk around with us, come on. And then next thing you know, this person is walking. And then next thing you know, this person is running a 5K. And then next thing you know, this person is running a half marathon and a marathon. And now like that belief and them pouring into themselves and like locking in the dedication that it takes to run, it starts to spill back out and go get more people. And it becomes this big contagious thing of people just celebrating themselves and showing love. And it's really healing the community at another level. So I'm grateful to be the leader of it.
You're giving me chills. That's so amazing. I mean, to start with love, right? I think that that's how you translate it, right? Is you show up and you meet people where they're at, and then give them that support and time to be able to grow into themselves. So that's amazing. Yes. So how can people find you and Peace Runners, and where can they engage? What kind of activities are going on and happening?
Okay, so we do have a website, www.peacerunner773.com. Our Instagram is peace_runners773. We have a social media manager that manages that, because it's hard to lead and also do social. But we make sure that we're up to date and put in everything that we're doing out. Look out for the mental health workshops, the mental health in motion. That's huge. You don't even have to work out or run at that date. It's just a resource that we just bring to the community free of charge. Everything's free of charge. We have a Couch to 5K program starting today. 32 people signed up, a real small group, but I like it that way because now we can really get to grow them as people. We got 2 Couch to 5K coaches. I'm excited to see them grow. And then hopefully they'll be running 13.1 next year, because we have a 13.1 training program that we do for 15 weeks, which has got a lot of people to do the half marathon. And we also do marathon training. So anybody training for anything already, we do not have any barriers when it comes to running for Peace Runners. Come out and support.
Wow, that's so great. That's so great. So hopefully you all got that information, or can look up Peace Runners so you can get involved, and also spread the word about such an amazing resource.
Yes, thank you so much.
Do you feel like we missed anything else that we haven't mentioned?
No, I think we got everything. I don't want people to be intimidated. So many people are intimidated with run when we talk about run. Yeah. We have walkers. For the moms, the grandmas, we have the young at hearts. They do Zumba. They do kickboxing on Fridays. They do kickboxing. They love kickboxing. They love kickboxing, but to just no barriers to it. Don't be intimidated. This racial life expectancy gap that we're talking about is relevant. If we do not take care of ourselves early on, it will make us pay in the long run. And nobody can beat that. Nobody can beat the fact of like not taking care of yourself and like wanting to live a long quality life. And we have so many people that we got to show up for as like family members and community members. We're needed. So some of the decisions that we make is not because we want to, but it's because we need to. So I just challenge everybody to take care of yourself, show up for your community, but then also show up for yourself. That's the most important thing. We can work really hard. We can work the 8 to 10 hour shifts, but we got to make sure that we do the stress management. We got to carve out that 30 minutes of walking or cardio. We got to start changing what we're eating, bring that nutritional value back. Eat the proteins. If it's not the proteins, if you don't eat the meats, make sure you grab some veggies. That's important for everything. Cut the carbs, add some veggies sometimes, but something to make sure that we are living better lives and living better quality of lives so we can keep closing this gap.
Mm-hmm. You are such a gem. I appreciate all of your work. We need people like you out there and just really creating those positive ripple effects. This is where it happens, right? The heart of what we all want to do and achieve. So thank you so much for being that example and also growing, being a model for all walks of life to be able to give and also to receive and learn ways to take care of themselves. It's truly an amazing gift. So I'm glad to have crossed paths with you and to have this conversation and share it with all of you. So thank you so much for being here today.
Thank you. It's huge for y'all to even have me here, for the opportunity to amplify the work that we're doing from a grassroots level. So we are truly appreciative. Thank y'all.
Thank you, Jackie.
All right.
Thank you. Have a good day.